this question and then you have to figure out कि इसमें हमें क्या use करना है. ठीक है? I'm going to give you 1 minute to mark this. Take your time and mark, please, everybody. सारे ऐसे questions we will be doing right now, okay, today. Okay, so some 40% of you managed to get it correct. Guys, just read this question. A 38-year-old presented to the general physician after he was diagnosed 1 day ago with an infection caused by a particular virus strain. Okay, he feels well but is currently quarantined. Okay, are you all with me so far? Chalo. The patient has read that hydroxychloroquine is an effective means of preventing infections with the virus strain and ask the physician if it would be appropriate to use hydroxychloroquine for post-exposure prophylaxis. A review of which of the following types of clinical studies is most appropriate to provide a recommendation to the patient. तो इस क्वेश्चन में क्या हुआ है? Can you figure out all the questions? I have almost 15 MCQs today where you have to use your brain and you have to identify these types of studies or the numericals that way. Okay, so can you tell me ये patient क्या चाह रहा है? The patient is simply asking the doctor that doctor, can hydroxychloroquine be used for post-exposure prophylaxis? Yes. So to be able to be answer that, कि वो answer आप कर सको, what type of study designs will be most appropriate, everybody? That means you have to see whether certain clinical trials have been done by using hydroxychloroquine or not. Did you understand? Are you with me? How many of you understood this question? Question was not difficult. Just ये सब story है guys. Like I told you, जितना लंबा question होगा, उतना it becomes easy for us to solve. So all this is story. Look at the next one. Is it appropriate to use hydroxy for post-exposure prophylaxis? A review of which type of clinical studies? Not ecological, because I'm talking about a drug. I am not going to study about the population characteristics. Prospective cohort. Why not cohort, guys? You don't do an intervention in a cohort. It is simply an observational thing, everyone. Are you with me? And case series report is which type of study design, everybody? Case series report. किस type का study design होता है in the comment section? Case series report is a type of a descriptive study. So obviously that's not going to help us. So what becomes the answer? RCT. बहुत प्यारा question था where they are simply asking you that doctor, is hydroxychloroquine useful for PEP? So for that, you look at the clinical trials published. Got it? Thumbs up, everyone. Can I go to next, a similar type of question? So all questions are like this today. Okay, for all of you to practice. चलो, अब एक easy सा question तो नहीं बोलूंगी, but you have to quickly do the calculation. I am not going to read it. Read it yourself. Take 1 minute and try to solve this. Okay? All right. Let's see. Good, Kajal, Ashna, you've answered very quickly. बहुत मजेदार क्वेश्चन करेंगे आज, so बिल्कुल don't worry, that will get you into practice. हो गया? Roshan, I've seen your question, dear. I have it on my group. Abhi we'll discuss it before the class ends today. Pakka se, okay? Don't write it again. I will, before the class end, I'll call out your name and we'll do your question. Okay, dear? All right, let's now focus on this. Before the class finishes, we'll address your question. Okay? All right. 21% of you got this question correct. Guys, what is it? Have you seen this question before? No. These values are different. आपने क्या calculate करना था? All this is story. Which of the following is the median? So what is the median, everybody? Median is which value, guys? You all know it is the middle value. Is median a measure of central tendency or a measure of dispersion, everybody? Is median a measure of central tendency or a measure of dispersion, guys? Central tendency, mean, median, mode, they are the measures of central tendency. Very good. So here it is the middle value when data is arranged in ascending or descending order. How many of you arranged it in the ascending or descending order? Whichever order you arrange, you have to first arrange it into ascending order. Is that okay? So to determine the median, the data must be arranged in ascending or descending order. The values of this set, this is how you're going to arrange it. Then how many observations total are ascending में? 1, 2, 3, 4, 5, 6, 7, 8. So guys, when n is equal to 8, what is your median? Or when n is equal to even number of observations में, what becomes your median? Everyone, it is the average of the two middle values. Simple. Prachi, don't go by the complex formula here. Just remember it's average of the two middle values. So over here, which are your two middle values? 100 and 102. Why? 90, 95 and 100 is below, and 102, 105, 109, 199 is above 119. So average of two middle values. Is that okay? All right. If suppose n was equal to 7, in case of odd numbers, it becomes very easy. Simply the middle value, right? Simply the middle value when data is arranged in ascending or descending order. One more thing, guys. जब odd होता है ना, what is the formula? Please look at this formula. N plus 1 by 2th value. All right. Okay. And when it is even, what is the formula? Once in one of the AIMS papers, बहुत पहले they had given to identify the correct formula. So when the n is equal to even, formula क्या होता है? Anybody knows? N by 2th plus n by 2 plus 1th value divided by 2. Are you all with me? Everyone, but you don't need to use these formulas. जब number of observations आपके odd होंगे, बहुत ही simple है, middle value. जब number of observations even होंगे, take the average of the two middle values. Please remember, this is value. So if it comes fourth and fifth value, look at what is the fourth value and look at what is the fifth value and then solve it. Got it, everyone? Can I go to the next question? I want all of you to understand these questions. We are not in any rush. ठीक है? समझ में आ रहा है? All right? चलो आगे बढ़े फिर. चलो आगे बढ़ते हैं. ठीक है? चलो, take your time. Read this question. ठीक है? Don't be in a rush again. Take your time. I have simply asked you a conceptual question. Okay? So you have to take your time. Take 1 minute, proper 1 minute. Let's keep it 75 seconds. Try to solve it. आराम से पढ़ो. कोई जल्दी नहीं है. Many times you've studied case control. I'm just asking you, who is the best control over here? That's it. Socho, guys. Nobody has answered correctly so far. Okay, I think one person got it. Anisha and Sachin have got it. Spot in. Okay, so I gave you 75 seconds, 1 minute 15 seconds, and 23% got it correct. Good. What was this question? Not difficult, guys. Not difficult. मैंने आपको क्या बोला है? There is a case control study to evaluate the relationship between whatever benzodiazepine used among elderly population. What is my cases, guys? Older than 65 years of age that resides in assisted living facility and the risk of developing Alzheimer dementia. 300 patients with Alzheimer dementia are recruited from assisted living facilities and the rates of benzodiazepine use are compared to 300 controls. So we have a proper case control study. Cases मैंने कहाँ से लिए हैं? Women who are older, people who are older than 65 years, one thing. What is the other thing that you notice in the cases, guys? Assisted living facilities से आपने लिया है, ठीक है? And you've asked the rate of benzodiazepine. So guys, whenever you have to select your controls, what do we say? That the cases and controls should be similar in all possible aspects, other than, of course, the disease under study. If my cases has Alzheimer's, my controls also cannot have Alzheimer's, है ना? But rest cases and control are matched for every possible factor which can affect the outcome of my study. Are you understanding? And what are those factors called, everybody, which can affect the outcome of my study? If we do not have similar cases and similar controls, confounders. Very good. तो जब हम controls चुनेंगे, let us read the first option. 80-year-old man with well-controlled hypertension and mild BPH who lives in independent living community. Why will I select a control? Age is okay, above 65, agreed. But why will I select a control from an independent living community? That might act as a confounder. Are you with me? Everyone, option A clear? Option A, chalo. Option B देखो. Alright, 64-year-old man with well-contained hypertension, mild BPH, ठीक है, assisted living. So the place of residence is okay, but look at the age, guys. Why should I choose a control who is less than 65 years of age? Did you understand? जब मेरे cases older than 65 hai, my controls also should be older than 65. Otherwise, confounders will come and play a role in my study. Got it? Look at the third one, everyone. A 73-year-old female, all right, age is okay, with coronary artery disease, who was recently discharged to an assisted living facility. Find assisted living facility from the hospital. No, now this has altogether a different presentation. So that is out. Look at option D now. 86-year-old male, age matched, well-controlled hypertension, BPH matched, who lives in an assisted living facility matched. The only thing that this 86-year-old male doesn't have is that he's not suffering from Alzheimer's, because he's going to be a control. Got it, everyone? So when you read the explanation, you can read over here control group, because the presentations are different, Ravi. ठीक है, वहां पे हॉस्पिटल से cerebral stroke, all those things. Why should we go for that when we can select a simple control residing in the same area, having controlled BPH and hypertension? Got it, dear? देखो, control group and case group should have similar baseline characteristics and be recruited from the same study population. This should recruit individuals, age, and reside in an assisted living facility such as this with no history of Alzheimer's. Got it? तो तुमने कितनी बार पढ़ा है ना case control? This is how you select your cases, controls. Next time, guys, I can ask you ratio of case to control. Anybody? What is the ratio of case to control that I can select? Anyone? कितना ratio है? Good, Yash. Good, Yashant. The ratio is good, everybody. 1:4. One case के लिए maximum I can go up to 4 controls. But when can I take for one case 4 control? जब मेरा sample size is less than 50. When my cases are less than 50, and the cost of collecting the cases and controls, all right, are almost equal. I can go for one case up to 4 controls, but अगर मेरे cases बहुत ज़्यादा हैं and the cost of collecting are different, maximum 4 controls. This can also come as an MCQ. Why not more than 4 controls? Leads to data fatigue. Is that okay? Everyone understood this MCQ? Everyone? All right. So every Monday also we'll be practicing these MCQs. ठीक है? चलो. Can I go to the next one? Can I proceed to the next one? Okay. नहीं समझ आया? Put in the question section. I'll talk about it again before we finish the class. ठीक है? चलो. Take your time, everybody, and identify which type of study design is it. All right, I'll give you 60 seconds for this. आराम से पढ़ना. Look at the buzzwords. Good, Shrinu. Take your time. आराम से. Good, 35% managed it. Some more can manage it because there is a buzzword clearly over here. 32% got this correct. What is the buzzword I'm talking about over here, guys? Anyone? Population. Look, after learning in a lecture that C-section rates vary from less than 0.5% to over 30% across countries, a medical student wants to investigate if national C-section rates correlate. The first word, all right, correlate with national maternal mortality rates worldwide. So I have to consider national C-section rate. That means, let's say the C-section rate in one country, which is, let's consider India, with the national maternal mortality rates worldwide with the other countries. So what am I doing, guys? I am comparing the C-section rate in what, guys? I am comparing the C-section rate in different countries. Different countries, matlab, I can write it as different populations. समझ में आया? Now, for his investigation, the student obtains population data from a registry that contains tabulated C-section rates and maternal mortality rates from the last 10 years for a total of 119 countries. For the last 10 years, I go and collect data which is already present. तो मैंने कौन सा डेटा कलेक्ट किया? प्राइमरी या सेकेंडरी? I've taught you in class classes also. जब you have a database already present with you, you are doing secondary data. देखो दलजीत, let's read it once again, everybody. Okay, let's read it. It's not a retrospective cohort. What's your name, dear? Priyakshi. It's not a retrospective cohort because the first thing, you are not doing your study on individuals. All right, and you are not determining the outcome at the time the study begins. No, you are using a population data, secondary data. ठीक है, population के लिए your unit of study is population, not individuals. And how will you plot this? Like this. Can you see this? Whatever relationship comes, these dots will represent different countries. All right, and these are going to represent the C-section rate. All right, primary in a ecological study design, it is also called as, what are the other terms for ecological study design? Anybody can outline me the terms for ecological study design? बहुत सारे इसके भी terms है, guys. What are they? Number 1, correlational. Good. Number 2, anybody? Aggregate study. Number 3, Population study, very good. Also, you can say it in some cases, they call it as geographical study as well. All right, so it is a correlational study where you are comparing what? You are comparing the mortality rate, C-section mortality rate for different countries. Did you understand? Read this with me. Everyone focus on this slide. An ecological study is an observational study. Yes, observational means, is it descriptive or analytical? We all know it is analytical observational study that assesses data collected at population level for exposures and outcomes. It's collecting the information on exposures and outcomes at the same point of time, but from secondary data, not primary data. You as a researcher is not collecting data. Data already collect kiya hua hai, theek hai? It is used to investigate causal relationships between a specific factor. Over here, C-section in this case, and its outcome, maternal mortality at the population level. The student collected and studied the data for C-section and maternal mortality for many countries. Now read it. As each unit of observation was an entire country, large population, this study design is an ecological study design. Ecological ke liye buzzwords would be correlation study. You are studying the entire populations, comparing whatever rates between different populations using secondary data. Is that okay, everyone? All right. Ecological studies cannot be employed to draw conclusions on an individual risk. Example, the personal risk of maternal death in a patient with or without a C-section. Now, what is this called? This is called as ecological fallacy. Okay, if based on the data of a population, I say that all those mothers who suffered from maternal mortality had a C-section done, that would be wrong, because maybe the women who suffered from maternal mortality might not have died due to C-section. Is that okay, everyone? Ecological fallacy, समझ में आया सबको? Where you interpret the findings of a population to an individual which he or she might not possess as an individual. ठीक है? Chalo. Let us go to the next question. It's more important to understand. We are not going to do it in a rush, guys. Then you forget the concept of फिर गलती हो जाती है. Okay? Don't worry, Athena. Take it at a cooler pace so that it gets imprinted in your mind. Okay, next, can we go to the next one, everyone? If anybody has not understood, you can put in the question section. I'll take it once again. Chalo, now read this. मतलब मैं नहीं read करूंगी, तुम read करो and mark it. ठीक है? I'll give you 45 seconds with this. Okay? Think. The buzzword is already there. I've simply asked you phases of a clinical trial in a different manner. हो गया? Okay, 52% or 55% of you managed to get it correct. Fair enough. 53%. What was your buzzword? It was a simple question over here. A group of investigators is planning, मैंने तो लिख दिया ना, phase 3 clinical trial. What is phase 3 clinical trial? It's actually an RCT. Yes, everyone, where you are comparing your drug with an existing protocol, a standard drug से आप compare करते हो. RCT में कितने लोग participate कर सकते हैं, guys? What is the participation in RCT? At least 500 to 3000 can be the people, the number of people who are participating. So over here, small number of healthy volunteers? No. Is phase 3 healthy? No. Which phase is healthy, everybody? Healthy volunteers किसमें लेते हैं? Phase 0 and phase 1. Is that okay? We take phase 0 and phase 1. ठीक है. Evaluate the efficacy and safety of BG45 against standard of care. देखो, so standard of care is the existing protocol. So here you have this as RCT and you take large number of patients. Is that okay? All right, everybody, did you understand? Efficacy and safety वाला कौन सा level होता है, guys? You are doing efficacy and safety. In which level do you do the efficacy and safety? Adverse event phase 1. All right, okay. Efficacy and safety phase 2. Yes. All right. Maximum drug failures occur in phase 2. Evaluate the safety. Large number of people में करने का उतना जरूरत नहीं है, but it is an RCT over here because here we are confirming, we are comparing with a standard care. Is that okay? This was an easy. This set of characteristics describes a phase 3 in which a new treatment is being compared with a current standard of care or placebo in terms of safety and efficacy. All right, everybody, after which phase is a drug launched in the market? After which phase is a drug launched in the market, guys? Quickly tell me, then I'm going to proceed. After which phase is a drug launched? Phase 3. Post-marketing surveillance क्या होता है? Post-marketing surveillance कौन सा phase होता है? Post-marketing surveillance phase 4. The longest of a clinical trial. Ideally, it should continue lifelong, but हम लोग adverse events के लिए at least 10 to 25 years, even after launching the drug, we do. Okay, all right. Can you all focus on this question now? Let's see if you can mark it. ठीक है? आराम से करना. Don't be in a rush. Yeah, do it. Figure out how this will be done. Does it involve too much of calculation? Think like that. जरूरत है या तुम ऐसे figure out कर सकते हो? Take your time. Think. Okay, 50% managed it. Good, guys. Have I ever told you what percent of observations, like 87% of measurements, कभी हमने किया है? हमने क्या क्या किया है, guys? Mean plus minus 1 SD. We all know it covers how much? Mean plus minus 1 SD, 68%. We all know mean plus minus 2 SD covers how much, everybody? 95%. And we all know mean plus minus 3 SD covers 99%. एक और जो मैंने आपको बताया, because it was asked, mean plus minus 1.64 SD covers 90%. So what does this mean? That now you have to learn for every percentage, 87, 88, 89. Is it possible? It's not possible that you can learn for everything. So how can you figure out from here? यहाँ पे क्या दिया हुआ है? This standard deviation is 100, mean is standard deviation is 10, mean is 100. So if I ask you what values lie within 68%, can you calculate and tell me? 100 plus minus 10 is 68%. So what values lie within 68? 90 to 110. Okay. What values lie within 95%, everybody? Can you tell me? Please quickly calculate करो. 95% के within कितना lie करता है? कितना आया? 80 to 120 lie within 95%. Now I have given you, and tell me 99% also quickly. एक बार 99% भी बता दो. What values lie within 99%? 70 to 130 is 99%. Everybody agrees. Now what is the trick to solve this question? 87% may 70 to 130, can it be the answer? Can it be the answer? 70 to 130, of course no, because this is this one. 65 to 135, can it be the answer? जब 68% is between 90 to 110, so can whatever value is 65 to 135, it is something wrong, it's below that only. No. 80 to 120 kitna hai guys? Exactly 95. So what are you left with? For 87%, it is that value which is lying between 68% and 95%. So which is that value? More likely 85 to 115. Now now for 87% of observations, what is your Z value? Just say 1, 2, 3, 1.64. These are your Z scores, right? For 87%, look over here. There is only one answer that lies between 1 and 2 standard deviation exported from the mean. In a normal deviation distribution, 87% of measurements fall within 1.5 SD. But I cannot remember कि अब 87% के लिए 1.5 होता है ना? It's too difficult to remember like that. So the best thing is 87% के लिए it is something between 68% and between 95%. So this was the only value which was justifying it. Did you all understand? Did you all understand? Everyone, thumbs up if you understood this question. Please don't think I will ask you to memorize the table. It's not possible. मैंने खुद आज तक memorize नहीं किया है, तो मैं तुम्हें कैसे बोलूंगी ना that you have to memorize all the Z scores. It's not possible. You can only memorize these Z scores, everybody. All right? Okay? But rest, try to figure out, remember this question and try to figure out the rest of the ones. Okay, otherwise in exams they need to give you the table. Otherwise there is no other way. Chale, next important question, one more tricky question.